We move on to the next paper. Dr. Preeti. Prognosis and outcome of wavefront guided single pass 4th row pupilloplasty in post-PKP patients.
Good morning, everyone. The topic of my paper today is prognosis and outcome of wavefront guided single pass 4th row pupilloplasty in post-penetrating keratoplasty patients. Financial disclosure is nil. So penetrating keratoplasty, it's a surgical procedure in which we know that a damaged or a diseased cornea is replaced with a healthy donor cornea. But one of the most common complications of this procedure can be irregular corneal astigmatism, which can lead to significant visual disturbances such as blurred or distorted vision. So in this study, we have explored the benefits, risks, outcomes of wavefront guided single pass 4th row pupilloplasty in penetrating keratoplasty patients. So it was a prospective observational study, and it included a total of 13 eyes of 13 patients who underwent penetrating keratoplasty at least 6 to 12 months prior to in our study, and they had a pathologically dilated pupil of 5 mm or more in size, and the graph was clear. And these patients were subsequently taken up for the pupilloplasty. So all those who had an opaque or a hazy graft and where there was a loss of more than half of iris tissue had to be excluded. The assessment was done in the preoperative period, which included a comprehensive ocular examination and a Schemflug corneal mapping, where the wavefront analysis was done in the preoperative period, where the actual pupillary size was noted, and a predicted wavefront analysis was done, where we set the desired postoperative pupillary size to 2 mm, and where there was a significant difference between the preoperative and the predicted post-operative values. Those patients were taken up for the single pass 4th row pupilloplasty. So all the patients pre-operatively and post-operatively were evaluated for their visual acuity, pupillary size, and the wavefront parameters, which included the optical path difference, the root mean square value for the high orders, astigmatism, coma, and spherical aberrations. The optical quality summary was also seen in the simulated visual acuity and the point spread function. The statistical analysis was done as follows, and a p-value of less than 0.05 was considered as significant. So as you can see in these pictures, clearly there was a reduction in the pupillary size from a mean of 6.08 to a post-operative pupil size of 2.54. The wavefront parameters also showed a significant difference from the pre-operative, that is after penetrating keratoplasty, to after pupilloplasty. These were the results, where the visual acuity showed a statistically significant improvement post-operatively. There was an improvement, and it was seen in the wavefront parameters, starting from the root mean square values, the higher order aberrations, the mean astigmatism, mean coma, mean spherical aberration, and the mean point spread function, which suggested improved image formation. So a consolidated image is in front of you all, where there was a statistically significant difference between the pre-operative wavefront parameters and the post-operative parameters, while there was not a statistical significant difference between the predicted and the actual post-operative values. So after comparing all the three values, a significant improvement was seen in the visual acuity and in the wavefront parameters. The point spread function and the simulated visual acuity also showed a significant change, and it was associated with a reduction in the symptoms like glare post-penetrating keratoplasty. So to conclude, a large number of post-penetrating keratoplasty patients have poorer visual performance due to irregular dilated pupil. And the wavefront guided single pass 4th row pupilloplasty can be a cost-effective and efficient method in these patients. It can help us in predicting and providing an optimal visual rehabilitation of post-penetrating keratoplasty patients who experience irregular astigmatism. So the following are my references. Thank you so much.
One basic question I have.
Sir.
Was this done during the time of keratoplasty or?
So 6 to 12 months post penetrating keratoplasty.
But don't you think that will add to the trauma to the endothelium and probably hasten the graft failure?
Definitely the authors had concern regarding graft rejection, but this procedure being minimally invasive, it did not show us many such complications post-operatively. All patients were fine, sir. No graft rejection was noted.
Maybe retrospectively we should do it during the time of the primary surgery rather than do it as a secondary procedure. I mean, that's my view.
Sir.
Was a specular done anytime, as sir mentioned? There is always a risk of endothelial loss in any procedure.
Ma'am.
Did you document a specular pre and post-op?
Not in this study presently, ma'am. We have not documented
And
specular
another
also.
question, you have mentioned that the wavefront guided astigmatisms, that has improved. What was the real spectacle correction? What was the refraction?
So the
Was there a change?
Yes, ma'am. There is a change in the best corrected visual acuity. So it has changed from a value of like in some patients from 1/60 to 6/12 as well. So there's been a significant improvement seen due to a reduction in the pupillary size. So in all parameters, ma'am.
Why do you call it wavefront guided single pass fourth row?
So, sir, we have...
Because you're
Yes,
using
sir.
the wavefront machine to calculate pre-op values and post-op
So,
values. But at the time of single pass, you're not using the wavefront machine.
So we are using the wavefront analysis to predict. So we are only doing pupilloplasty for patients where we are predicting that the pupil size will reduce and the parameters will become better. So we are not doing it for all, but we are also predicting the results, and then we are proceeding with the pupilloplasty. That's why we have included wavefront guided.
I think the title could have been a little more explicit.
Sir.
You can expand the title. They allow quite a few characters in the
Sir,
title.
sir.
Yeah.
Sir.
Any other questions?
Just one comment, actually, the single fourth row pupilloplasty in itself is such a complicated task.
Sir.
Sir mentioned when you're open sky, it's easier to do it, right? Just a comment. Thanks.
Thank you.
Thank you so much.